This is your co-host, Wes Lyon. Next to me, I have Dr. Scott Menaker. Scott, how are you doing today?
Doing great, Wes. I hope you're doing super.
Oh, absolutely. This will be our first episode to be released on YouTube.
Oh, very exciting.
So we have the cameras. Those of you listening on Spotify, if you'd like to watch, see what we look like, we're here in our true form. We didn't wear suits for this or anything. We're just here in our daily stuff. But I think that's exciting, moving a step in the right direction.
Very, very good.
But today's episode, Scott, I want to talk about something we've been chatting about. We like to call it follow the rules. And we've been talking about how it applies to staff members getting a second chance, just overall being successful. I don't know it necessarily is a dental specific concept. However, it's going to be very, very important in dentistry because, you know, if I would take it, and I've never been a dentist, but if I'm an associate dentist and I show up in somebody's practice and I'm not following the rules and their staff members take notice, am I in trouble?
Well, I think there's probably a reasonable chance that you're going to get called on the carpet. What I found over the years and through my 38-year career was a lot of times it's the other staff that are really going to notice what's going on. One of my dental assistants, Lisa, was with me for 28 years, just a dynamo, but she understood the reason why we did things, from sterilization to materials to stocking things. And when people didn't follow those, put them in the right place, or something was missing, or did that set of instruments get properly sterilized, or did I cut corners because I was trying to hurry things up or I needed something? She was always there to try and, she was almost like the police officer and the traffic director, which was great. But she shouldn't have had to be that person. And that's really what we're going to kind of talk a little bit through today, is making sure that you're being your own traffic cop, and that you're making sure that you're following the rules, because there's certain things that we'll talk a little bit about materials and we'll talk about staff. But there's a reason they're there. They're not there to drive you crazy. They might drive you a little bit, but they're there for a reason. And we want to make sure, as you got to start as you're thinking about it, as you're getting into your career, that how are you doing that? And if you need to change the rules a little bit, do them the right way. Don't just make your own decision. And
well, we were talking about one. It reminded me of a story. When I first started working here a long time ago, John, just, no, we do it this way. No, we do it this way. And I was sitting there and I'm like, man, you could do this on the computer. I now refuse to do my job on the computer. And I figured out why John had it on paper. And there was something there that, okay, this man now knows. And now I'm the guy that's like, no, we're going to be on this piece of paper. It works. You were talking about something that reminded me of that. And I know nothing about this topic, which is why I kind of equated it to something we do. But okay, you're talking about if you're supposed to rent material or something you want to use for 15 minutes, that you can't cut that corner. So can you expand a little bit material wise, all these things that they're going to do?
So, one of the things that we're all trying to hurry things up, and there's a reason, especially let's talk about the simple one for us, which is bonding and doing bonded restorations with composite. In the old days, as we were first getting started, we're now on probably like the 8th generation of these things. So you can stick material to almost anything, but we had a really difficult time back on the first generations and then the second. And part of it was there was a piece of you would acid etch something for 15 seconds. And then you would rinse it for 10 seconds. And then you would apply a bonding resin for 10 or 15 seconds. And then you would air dry that to thin it out. And then you would cure it for a certain amount of time. And the easy thing to do in all of that is cut corners, right? Hey, listen. And even to this day, I would have a dental assistant that I would put the bonding resin on. You're supposed to leave it for, let's call it 10, 15 seconds and let it, sometimes you would agitate it. Sometimes you just let it sit. And within 2 seconds, the assistant's picking up the air syringe to thin it. And I would kind of just put my hand out in front of the patient's mouth and just go, wait, I just give a I said, wait. And then afterwards, I would explain this to them. I understand we want to move things along and you're ready to go. But part of it is the manufacturers have designed this for a reason. They're not doing this to drive you crazy. They're not doing this to drive your assistant crazy. They've done tests to say, what do we think the time is to get the maximum bonding and adhesion, which is going to make your restoration more successful. And so the thing that we're kind of stressing here at this first part is if you're unfamiliar with a material, get the instructional sheet. Talk to your dental sales rep. Call the company if you need to get the instructions, but make sure you're following those things. If it says it needs to set for 2 minutes, you probably could cheat 5 seconds, but don't go cheating 30 or 45 seconds because you're gonna potentially mess with the hardness of the material or the bond strength. And those are things that are going to come back to haunt you.
So when I hear stories, now it's kind of fascinating to me. When I hear stories about people that had to get work redone, I won't name any places, but I know some places in Charlotte, like, oh, they had to get work redone. It sounds to me like it's possible that the dentist actually had a skill set. They really needed the work done, and maybe they just cut a corner on a material and it didn't bond.
It could be some of that. There's lots of things to consider from how big the material is. I mean, you can get anything to stick for till they walk out the door.
Right. I'm just thinking
but you're
from a young doctor, let's say, I have
sure.
to go in, and this is going to happen. We all make mistakes. I mean, I don't do dentistry, but I remember the biggest mistake I ever made, and John just blowing me up over it back in the day. But you make a mistake and you have to redo work, and, you're just going into the senior doctor and you're trying to get better. It's kind of a little embarrassing if I didn't follow the instruction sheet, right?
Right. And most of the time, you're not going to admit that, but you got to really, we may have talked in previous episodes, but we'll talk about them in future ones is if you have a failure, and we're going to have them, you may I did bonded restoration at the end of my career, and 2 days later, the patient showed up and something chipped. It wasn't because I cut a corner, because I knew I didn't do that. I might not. Then I got to start thinking, did I maybe not check the occlusion right? Is the patient doing something? I had patients that were biting their fingernails, that were chipping off restorations. Nothing I can do about it, but I had to try and get to the bottom of it. But you really want to understand where eliminate all the things that might be a failure. Stuff's going to potentially break, crack, chip, but you want to eliminate that. And the biggest way to eliminate that is just to follow the rules. Make sure that you understand, if you're going into a new practice and they're giving the assistant's giving you a bonding resin and you put it on and she's air drying it, and 1 or 2 seconds later, something is not right. Nothing is working that quick because of the way that they're trying to get the bonding resin down into the dental tubules. And yeah, I know nothing you would know anything about, Wes, but there's a reason why.
It reminds me of, I'm big into cars, the manufacturing process on cars. And I follow this because my wife wants, I probably shouldn't bad name any car companies for the sake of being sued on a dental podcast.
Right.
But there's a car company that makes very large SUVs and my wife wants one. And I sit there and I follow this stuff and I know they have broken manufacturing processes. And I'm like, I know there's a 25% chance that this car blows up. Like,
right.
Not actually blows up, but I mean, we're putting $30,000 into a brand new vehicle. I refuse to buy from this company. Kind of reminds me of the same thing. It's like, yeah, it could be well engineered, but if you don't follow the quality control to a T, whose fault is it really? Right. Is it the design? Is it, the dental work? No, you gotta follow it, it sounds like.
Yeah, and it's the same thing. We cement a lot of restorations. Crowns, we're going to cement our own crowns, but we're going to also, as a new dentist, a lot of times you're going to see people coming in on your schedule you're going to be re-cementing crowns that have come off. And and the question is, how do you make sure, to the best degree that you can, from cleaning out the old crown, cleaning that tooth, but then mixing that cement putting it in, letting it set properly, and following the rules. And each cement, they're all a little bit different. So you can't say, well, I use that one and this one's similar. It may be exactly the same. It may not. Just again, we're trying to ensure your success. And we're saying, just make sure you understand what it is, whether it's impression materials, scanning, anything, bonding, all of those things. You want to make sure that you understand. We're calling them rules, but it's the
Procedures.
procedures, and
Yeah.
instructions are really the name of the game. Many, many years ago, when I was getting ready to take in my first associate, I went back and literally wrote down a protocol system for every single procedure I did. And then I talked to my assistants about it because it was my way of making sure we were all doing everything the right way, so that when my associate came in, he had a book, or she had a book. In today's world, you understood how this was going to go. Now, I would imagine most dentists today are not doing that. But you just want to make sure, as you're starting your career and starting in practice, or you get a new material that's come out and the dental sales company's hawking it. Hey, doc, I got something you're going to love. You're not just saying, well, it's the same kind of thing. Read the instructions. And when it says 15 seconds, 20 seconds, 1 minute, just follow that. It will make sure that you're going to have a little more
Especially, you
success.
mentioned a lot of this stuff you get introduced to from a dental sales rep. Most of them have extensive manufacturing or dental experience, right?
Most of them are clinical. They could have been assistants, hygienists, could be somebody that just got a marketing degree.
Yeah, I met one the other night. Super nice guy. He was great. He actually, looking out the window, he works at this Patterson office right here. But his resume did not include anything clinical.
Right. And a lot of times, they're great and they're super resources for you. But sometimes, they're not going to be as adept on some of that stuff. A lot of times they will. And if not, they'll get the company to call you and they will help you. But sometimes they're not using it clinically, as you said, Wes. And so just make sure you know what works in your hands with your team. And I think it'll help prevent failures that are going to happen.
Absolutely. Well, I think that's extremely important. So hopefully everyone understands that one. I look at it in the view of manufacturing processes. And yeah, you can't, if you have one little thing go wrong on the front end, it's going to ruin the whole thing, even if it was, that big of a tolerance issue. And it sounds like could be just waiting 10 seconds versus 5 could create a tolerance issue.
Sure. And think about the, you're talking about cars. How many recalls are there for cars? And when they announce it on TV, it's not 1 or 2. It's 500 million that now these companies have to go back and fix. Now, again, they didn't do anything on purpose, but something happened in that process. And again, we're just trying to help you not have too many recalls.
Right. You don't want to be back somewhere blaming the company, and the company goes, "Did you wait 30 seconds?" And you go, "Huh?"
That's right. I didn't know I needed to.
The sales rep told me. It's like,
and I've had that stuff. I'll buy stuff at around the house and doing things, and if I run into a problem, I have no trouble going online and a lot of times I just kind of didn't think through. They're saying, hey, you need to mix this sometimes you got to mix some materials for 2 minutes. Well, it looks like it's mixed in 15 seconds, but there's a reason. So anyway, we just, again, encouraging you, understand the rules, the instructions, follow them. And that also carries over to working with your team.
Yeah, that's a big one we were talking about. And I think if you come in as a dentist, whether or not you're the newest person there, whether or not you have zero experience, I think you somewhat become a senior figure in that office from day one and a leader, and you have to be. So, I think, and correct me if I'm wrong, because I don't work in a dental office, but I would imagine if you're a dentist, you better be just on top of everything, every rule, there on time, not cutting a corner, because if you do, I would imagine the staff would see it. And if the dentist can get away with it, now the staff can get away with it. And before you know it, your office culture has rolled downhill. And if the senior dentist figures out that you're the one that caused it,
You know,
we know where that ends.
no doubt. So, it's interesting. Over the years, I had a number of associates. My first one was terrific. He decided to go back to pedo school, so I lost him. But my next associate, nice guy, but we just didn't. He wasn't jiving with the team as well, and some of that was just a little bit of his personality, and it didn't require me to be kind of to notice all this. They would kind of bring stuff to me. And so we'll talk a little more in a minute about teams, but at the end of the day, there were certain things we needed him to do. And he either thought he knew too much, would be probably what I would call it, is, and he recognizes later on in life, but he wasn't willing to listen and learn and follow the pattern and the rules that we had. And I basically asked him to leave. We parted friends, but I basically had to ask him to leave and then start kind of the process all over. And for those of you that, if you've been working or you're soon to be working, that's a hard thing to do. Finding a hygienist is one thing, hard today's world, but finding the right dentist that's going to fit in can take months and months and months of hard work. And then you're opening the doors to this person. So we would encourage you to make sure that be there early, stay late, offer to help, do all of those things. Because if you're showing up at, your day starts at 8 and you're showing up at 8:05, I know a hygienist that she works in this one office. They hired a new associate to come in there. And she said he wouldn't show up some days for 20, 25 minutes after 8:00. And she would come in and go, "Why didn't you start seeing your patient?" She goes, "Well, by law, I'm not supposed to be practicing dentistry without a dentist on site. And I'm not going to jeopardize." And he just was like, "Don't worry about it." And he didn't end up lasting very long there, but it just doesn't make any sense. But your team's going to end up holding these people accountable as well.
No, and even though you're an associate, you're still a leader. So if they're there at 8 and you're there at 8:25, in my mind, we got a big problem.
Big problem.
Big problem.
I was one of my pet peeves in life still is being on time. If someone says dinner reservations are at 7, we're supposed to be at the door checking in at 7. We're not getting there at 7:15. If someone's having a party, my wife knows it. We're not showing up at 7:30, 7:45. We're showing up at 7 because that's just.
Now, is your wife the same way?
She's pretty good about it. But it's just my thing. And I want to watch my whole life. I stay on time. And one of my pet peeves was running on time in the office. So we had a patient at 7:00 in the morning. We didn't start seeing that patient at 7:10. We started seeing them at 7:00. And when the 8:00 patient came, they were seen at 8. Now, if some crazy emergency came up, okay, maybe, but most of the time we were pretty regimented in our structure and our scheduling. We didn't run over. And I was telling Wes a little story earlier. We had a morning meeting that started at 7:15. And everybody was supposed to be there, scrubs on, ready to go. We're going to review the schedule for 5 to 10 minutes. And then they would be in their room ready to read that patient at 7:00 and get going. And I had this wonderful hygienist. She worked for me for about 10 years, but she, at some point, would start showing up 1, 2, 3 minutes late, and it was kind of consistent. And the last time this happened, we were starting the meeting. She walked in, and they all looked at me. And it was, okay, I couldn't just ignore it. Because I'd probably let this go on too long. And that was, again, my fault because I was just like, we're just, and I literally got up and I asked her to follow me to my office and I closed the door and I stressed to her, I said, you obviously don't value the importance of time to myself and the staff. We need to run on time. Everybody else is here. You're running late. Here's what I'm going to say to you. The next time you're late, I'm going to terminate your employment with us. Now, I had no desire to get rid of her. She was a wonderful staff person, but she just kept pushing the rules. And my team had just had enough. And they looked at me and it was, if you let her get away with this, we're going to start, there's going to be lots of other things. And she was never late again. And sometimes, there's a reason that you have those rules. You were talking earlier about, your staff and your team and.
Yeah, I inherited, it was just a wild set of rules depending on how long you had been here. And it's like everyone had their own rules. It's just not fair, to the other employees. So I had to rein it in and tell everybody, here's the rules. We've got to follow them. But the office culture will quickly just get out from underneath you when you start letting things go. And if you're that dentist, and you're in there in somebody else's office, we were talking about this, it's like everybody makes mistakes, and mistakes are absolutely expected and forgivable. Now that I'm on the other side of the table and I'm the one people coming to and they make mistakes, I totally get it. But, I can remember being scared out of my mind, first time I had to go to John and tell him, hey, the client hasn't even come in yet, and I think I just got us fired. And, John looks at me and goes, well, it sounds like we dodged a bullet. And I'm like, I just cost us $20,000. What do you mean we dodged a bullet? And then looking back, I get it. I was the person that was there 2 hours early, worked hardest, did everything by the book. John had so much trust in me that he was like, well, if you did something to get us fired, it's probably them and not you.
Right. That's right. And it's probably a good thing.
I got the benefit of the doubt. However, I've seen that happen with other people back before I was the owner and, John owned it. And other people ran into that scenario that showed up an hour and a half late. And you better believe John dug into every detail to make sure he knew it was their fault. And, with me, it was like he didn't care. And I think that's just not to say those are two wild extremes. Somebody out there can kind of put yourself in those shoes. The mistake is going to happen. How the doctor, the owner perceives you is something completely in your control. And if they perceive you as somebody who shows up 5 minutes late, you could be the best clinical dentist out there and you do, make one honest mistake, but you show up 5-10 minutes late every day, you cut out early. That perception of you is going to be that you're sloppy. Even if your work is just stellar, the perception's going to be that you're sloppy. So mistakes are going to happen. Follow the rules. Be a good steward of the office culture. That way you don't create problems for this dentist in their office. And if you do that, the mistakes are really just, I like to call them, are they really mistakes? They're learning moments, right? You as the senior person, whatever, it doesn't matter what role you're in, whatever junior person you have, it's to some extent, it's always an apprenticeship, even if, they have the right education. They're just learning moments.
That's exactly right. And it's an opportunity to grow. And we're just really, as we've talked through this today, we're really just trying to stress there's a reason there's rules. Some people say rules are made to be broken. I would probably not go along to agree with that one because I think you're gonna get yourself in trouble in many, many cases. If there's a reason a rule needs to change, go through the right, and you got a better suggestion. And my door was always open, and I was willing to change things, but we had a discussion about it and came to a consensus. Not just one person makes decisions. So, you're going to be part of a team. You're going to be treating a lot of patients many you've never seen before. You want to create a great culture. And part of this is, there's reasons you're going to do things by the rules. Follow those. It will serve you well. If you want to change, if you think things can be done better, the door should be open. but approach it the right way with your team and with your boss. And especially if you're the owner, how do you go do that the right way? And I think if you do that, this will help set yourself up for success today, 25 years, and 40 years down the road.
Also, we've talked a lot about, the best way to get out the student loan debt is to buy practice, right? Ownership has, great things that go with it. And you talk to the young buyers, but I spend a lot of my time with the doctors who are going to sell. And the first thing I ask them, if they have an associate, is the associate going to buy? Do they want to buy? Sometimes the associate wants to buy, and that senior doctor says, I'm not selling it to them. And it's not that they can't do it clinically. It's maybe not even they can't handle it. It's they have a bad gut feeling about that person. And that bad gut feeling, 98% of the time when you dive into what's going on, they show up late, they leave early, they cut corn. I mean, it's never, they're a bad clinical dentist. Yeah, it's always related to this stuff. So just make sure you do it. I think that's great career advice for anybody, but they exist for a reason. I like to call them, I don't know, rules, maybe procedures is probably the better,
right.
That doctor created that procedure because they found out the hard way back in the day.
Yep.
Learn from that mistake that was already made. I think it's flights. They say this kind of morbid, but they say on the flight rules that, this rule is written in somebody's blood because somebody made the mistake and crashed the plane. So you have to follow it. Now, fortunately, we're talking about dentistry. Right. So, it was written in somebody's dental mistake, but there's a reason that procedure exists. Follow it.
Right. And we'll talk. It's a good lead in as we go to probably our next topics. Really, we're going to talk a little clinical stuff. We've really not spent a whole lot of that. And so I'll talk a little bit in our next episode about some clinical tips. And some of that goes along with, following the rules and sometimes changing them a little bit. And we'll talk through some of that.
No, absolutely. Well, tune in next week and we'll be back. And for those of you who are listening, you can watch us on YouTube. But thank you for joining. We'll see you next week.